Okay.
Yes, we can hear you.
All right. Jazakallah khair. You can see my screen? Everybody can see my screen?
Yes, we can. Thank you.
Wonderful. Assalamu alaikum wa barakatuh. Salatu wassalamu alayka ya Rasulullah. My name is Dr. Samad Khan, and today we're going to be going through some of the medical needs and some of the situations that can occur during the Hajj, and to be conscious, and to be aware. It's not to frighten anybody. It's not to make anybody worry before they go, but it's important that with the experience of legacy and my personal experience at Hajj to try to advise individuals that have chronic health issues as well as healthy individuals on some of the things that potentially could happen, and hopefully that we can mitigate that by having this conversation, inshallah. So on behalf of Legacy Institute, being strategic partners with Albeit Guests, inshallah, we'll begin the presentation. So again, this is medical advice and health Q&A related to the Hajj and Umrah. And alhamdulillah, I've been able to go on the last few Hajj, and alhamdulillah, with the blessings of Allah subhanahu wa ta'ala, been able to gain some, knowledge on what happens on the ground, and what are the things that we need to look out for, inshallah. So we'll start with the required vaccines for Hajj and Umrah, right? So honestly, the only required vaccine is meningitis. Okay. Now this is a quadrivalent, and I'm hoping that everybody's gotten their vaccine already. If not, they need to do that ASAP, and really it's 10 days prior to arrival. And it shouldn't exceed 3 years. So if you got your vaccine, so I had one from 3 years ago that expires like June 1st. So it's better to try to better be careful, and not reach that 3 year mark. Again, COVID-19 is not required. It's not a required vaccine this year, inshallah, as well as last year. These are other vaccines that some people do get, more living in sub-Saharan Africa, yellow fever, polio, influenza. These are all things that and pneumococcal is one that's interesting, right? So anybody over 65, anybody that has chronic lung issues or chronic conditions, the pneumococcal vaccine is very important, right? Pneumonia is definitely a threat, with all the respiratory bugs that people bring. It's important that anybody over 65 should consider getting the pneumonia vaccine. Okay, so again, this is something updating your vaccine status against preventable diseases, Tdap, polio, measles, varicella mumps. These are all vaccines that as in America, we get regularly anyways, kind of in our routine vaccine schedule. So these aren't necessarily an issue. Some people did get the flu vaccine, I know from beginning of the year. It's something that I would consider doing. Again, if you have some chronic issues, see if your doctor has any of the seasonal flu vaccines available at this time. And I would say, you should probably do that. And little kids aren't going to be there, so obviously it's more for the elderly and the ones that have chronic diseases, inshallah. If you guys have any questions, so pretty much, sorry, this is going to be probably about 30-minute presentation, and we'll have 30 minutes for Q&A at the end. So try to hold your questions to the end, inshallah. We'll try to answer them all in this session, inshallah. So health risks related to Hajj. Crowding, right? So most of you, that have not been on Hajj, you're going to be in crowds that probably you guys have never been in before. And it can be at first overwhelming, but you get quite used to it. So it's not something to worry about, but just be cognizant of. And with crowding, obviously, there's higher risk of infections, right? So we're going to be going through good hand hygiene, things like that uh, to uh, to discuss. Weather. Um, so this is probably the biggest concern that we're going to have during Hajj. The temperatures last year exceeded were around 50 degrees centigrade, about 120 degrees Fahrenheit. Uh, this year it will likely get to that same level of heat, with the heat index being very, very high. So it's you're going to be in heat that you've probably never experienced in your life. And so there's risks of sunburn, dehydration, heat exhaustion, heat stroke. We're going to go through heat exhaustion and heat stroke very carefully. Last year, we had quite a few instances of heat exhaustion and a few instances of heat stroke as well, and many instances of dehydration. So it's very, very, very important to be cognizant of, you're going to be in a place that's very, very hot. People that, tend to say, "Oh, I'm going to hold off on drinking water because, of urinary issues. I don't, maybe I won't find a clean bathroom." That's all secondary. You need to be healthy and hydrated. Finding a bathroom does not, not finding a bathroom or, having to rush to go to the bathroom does not equal potentially having a heat stroke. So it's very, very, very important to constantly be hydrated, constantly be drinking water. And we're going to go through different ways of improving that, like using um, different mechanisms to help with the water being absorbed into the body. There's risks of accidents and injuries. So, people are going to trip, people are going to fall. So it's very important to have good footwear, and we'll be discussing that as well, inshallah. Food, water, so diarrhea, contamination, etc. This is a risk. We've seen, people that unfortunately with the heat, some of the food sometimes it can, you know, it can go bad, and that can lead to diarrhea. Even viral issues, viral gastroenteritis is a big thing. So when you have diarrhea, easier to become dehydrated. So we're going to give you, tips on maybe potentially bringing medications like Imodium, some antibiotics to take, just in case you develop, some food waterborne illness. Insect bites, not too big of an issue. I haven't seen, mosquitoes flying everywhere unless it rains, and then you might have infestation of mosquitoes. But, definitely important to bring insect repellent with you on this trip. And then, common infections, meningitis, potential. That's why it's a mandatory vaccine. Upper respiratory infections, gastroenteritis, hepatitis, not as much, and then heat issues. So these are all things to be cognizant about. So talking about fatigue and dehydration, right? So some of the causes of fatigue and dehydration, vomiting, diarrhea, fever, these are all going to lead to excessive water loss in the body, excessive urination, for example, diabetic patients, excessive sweating. So being aware that if you have any of these issues going on, that you need to drink more water. You need to continue to drink, hydrate yourself as much as possible. The symptoms of fatigue and dehydration. So sometimes most people necessarily haven't felt these symptoms before, so they might not know, hey, I'm feeling like this. Oh no, these are signs of dehydration. You need to get water in. So feeling tired, not your usual tiredness, from not sleeping, but being extra tired, where you really can't get up. You feel brain fog, where you can't think through clearly. Having nausea, vomiting, severe thirst. Your urine is very dark, yellow or even brown. Um, you feel like your heart is beating faster. So when you get up from sitting and your heart's beating faster, you then, that's a potential sign. Dry mouth, lips, etc. So if your lips are cracking and you have dry mouth, and for example, you're not tearing, your eyes are not tearing, not urinating for long periods of time, these are all symptoms of dehydration, and it's very, very important to hydrate yourself at that time, right away. So these are just some of the, I mean, we're not going to be doing this, I hope. I mean, most people aren't going to be walking these things, but these are just examples to show you how far the distances are. From Mecca to Medina is about 8 kilometers. From Mina to Arafat is about 14.4 kilometers. I did that walk my first year in the heat in the morning. It was very difficult. Mina to Muzdalifah. So this is something that some people do, and then even from Muzdalifah back to Mina. Some people do this walk instead of taking the bus, and 3 kilometers, it might not seem a whole lot, but in the heat, it can lead to potential side effects. And then nobody's walking from Makkah to Arafat, so you don't have to worry about that. So things that we can do now to prepare ourselves, right? It's very, very important. If you haven't started walking, if you haven't started getting out and going on long walks, or even at the gym, brisk walking for a mile, 2 miles, you still have some time. Still have a week to 2 weeks. Please, please, please start walking. It's going to make all the difference in the world. Even if you start now, even if you haven't done anything and you're like, oh my gosh, what am I going to do? Please just start walking. You're going to notice a big difference in your stamina. Even just a few days of walking will definitely help in preparing you, right? The last thing you want is for, your Hajj to be ruined or even to be affected in a negative way because, oh man, I didn't prepare myself. And so it's important to start walking. If you can even do some incline walking, that will help as well. Because there's some incline walks, going up and down to the train station that has some pretty significant little inclines that you have to be ready for, inshallah. And then packing, I'm going to give you a list of medications at the end, so you don't have to write all this down. And we'll also share, I believe Sheikh will share this with you guys to have this PowerPoint. Emergency electrolytes, fluids, electrolyte packets, very, very important. Very important. Everybody should just go to whatever, Costco, whatever, Costco, and get electrolyte packets. And you can just put that in your water every time you drink. So drinking regular water is good, right? But for example, if you have diarrhea, if you're vomiting and you're losing those electrolytes, you're losing that water, you have to put the electrolytes in it to get the benefits. So inshallah, it's important to do that. And then to avoid and decrease heat. So using an umbrella, spray fans, wearing light clothing, being in the shade as much as you can. All these are very important. The first year I did Hajj, I developed heat exhaustion. I was, just trying to do everything. Day of Arafat, I walked from Mina to Arafat and then sat for a few minutes and then walked to the mountain. And on the way back, I was feeling dizzy. I was getting lost. And so I had to sit down, drink lots of fluids. Umbrella is very, very, very important. You might not think it'll make a lot of a difference. And most of us aren't used to using umbrellas in the heat. In the Middle East and in places like that, people use umbrellas when they walk around normally, but we don't here in the West. But it's very, very important to have an umbrella when you're outside. And they have these umbrellas now that have these spray fans. They have all these cool gadgets in them. So look to invest in a nice umbrella as well, inshallah. And then obviously Zamzam will be available for us to drink. So drink as much. Zamzam itself has electrolytes in it. It has great properties, so it'll help hydrate you probably a bit more than just regular water, inshallah. Here's just a kind of a picture of the distances from Mecca to Jamarat. to the 10 cities of Medina. So I believe most of you or half of you will be staying close to Jamarat, and then some of you guys will be staying closer to Muzdalifah. Uh, so and walking from Mina back to Mecca is a possibility. There's people that do it. Sometimes you have to because of the traffic and there aren't taxis when you're walking back to do tawaf, things like that. So just be aware that, this is the distance that you're going to be traveling, inshallah. All right, the differences between heat exhaustion versus heat stroke. So it's very, very important to know this because you're gonna see people that have heat exhaustion. It's gonna be visible. It was last year all around us. People were having heat exhaustion. People were fainting at all points along the journey. Um, but that is you can deal with heat exhaustion, right? Heat stroke is a medical emergency. Um, so looking at the differences, heat exhaustion, you're feeling faint or dizzy, you're sweating profusely, your skin is like cold and clammy for some reason, you get nausea, vomiting, you develop muscle cramps, so cramp in your foot, in your calf, in your thigh, even in your stomach sometimes you get cramps. These are all signs of heat exhaustion. Um, Now heat stroke is different. Heat stroke is kind of taking heat exhaustion to the next level, and now you're confused, you're not sweating anymore. You check your temperatures, it was over 40 degrees Celsius. Your skin is hot, dry. You still have nausea and vomiting, and you may even lose consciousness. Sometimes you can even have a seizure. Now, with a heat stroke, you have to call the ambulance and go straight to the hospital. Heat stroke, unfortunately, it cause death or permanent disabilities. So it's important to recognize the differences between these two, and get to the proper facilities or call the proper authorities if you see somebody who's becoming confused, who's having dizziness, or who loses consciousness. To avoid heat, like we talked about, avoid hot, crowded areas as much as you can. Obviously, you can't do that kind of the whole time, but uh, we're going to with El Beit and with Legacy, we're going to try to facilitate, not going to Jumu'at at the peak times if possible, not doing tawaf at the peak times if possible, trying to get out or go early to places. So Legacy does a great job. Sheikh does a great job in trying to, mitigate some of these issues. Alhamdulillah. Avoid direct exposure to the sun as much as you can. Take breaks and rest. Don't try to be Superman or Superwoman. It's not worth it. Trust me, it's not worth it. If you're feeling tired, sit, take a break, drink some water, get into some shade until you start feeling rejuvenated, and then kind of carry on. If your group is going and you're running behind and you're trying to catch up to them, it's okay. It's better that you rest and catch up to them than potentially, get into a worsening situation. Ensure adequate fluid intake. So, sometimes the plastic water bottles get hot. So if you have a nice water bottle that keeps, the water cool, try to utilize that, maintain that. Using light color umbrellas makes a big difference. Black umbrella is going to absorb heat. Try to use light umbrellas when you can. And then light colored clothing also makes a difference.
سمية الامبريلاز اللي بعتتهم بيان وايت ولا بلاك؟
And then, sorry, I'm going to have trouble muting. So if you could just mute
بيان بعتت امبريلاز وايت ولا
videos.
بلاك؟
سود سود
سود. بيقول استخدموا الشغلات الابيض لانه الاسود بيمتص الحراره،
Sorry.
حتى بالنسبه للبس النسوان عم بيقول البسوا ابيض.
Thank you very much for that. Where was I? All right. Now, if something happens, you developed a potential heat stroke, right? Immediately remove your outer clothing and cool the bodies with water as much as you can. These are all things, I mean, these are potentials, right? We want to mitigate the worst possible scenarios. And if something happens, God forbid, that you can, do something about it. So this is why we're giving you this information, not to scare you, not to frighten you, but just to prepare you for it, inshallah. So if somebody develops the symptoms of a heat stroke, make sure you remove their outer clothing, cool the body with water as much as you can, transfer the person to an air-conditioned location, put ice, around their neck, kind of cover them with ice. Make sure they're trying to drink as much fluid as possible. Air-conditioned fan is important, and then obviously call medical services and proceed to the nearest healthcare facilities. Pregnancy and Hajj. So there are, Hajjis that, mashallah, do fine. They come, pregnant. Alhamdulillah, they do very well in Hajj. If you have these symptoms, if you have, preterm birth risk potentially, it's potential for you to postpone Hajj. It's okay if you do it at that point. Risk of early miscarriage. If you're diabetic, or you have preeclampsia with diabetes, if you have any of these other symptoms like hypertension, heart disease, kidney disease, pregnancy, it's probably better to postpone Hajj at that point. If you have a history of dehydration in pregnancy, or if you have pregnancy bleeding, these are all things that you need to look at. And then you should really talk to your medical provider at this point. Menstrual periods. Okay, this is mainly for the woman, but we'll go through it quickly. Obviously, most of you, I'm sure, have already discussed this with your OBGYNs. To delay periods, consider oral contraceptives. There's really two types that I would recommend. Obviously, there are side effects to OCPs, right? Nausea, vomiting, headaches, breast pain, mood swings, emotional, irritable. So if you're not used to taking them, be aware that this could potentially happen. It's natural to have these side effects. Again, taking things like Motrin definitely help with these symptoms. All right, so it's not recommended to take birth control pills if you have these symptoms like high blood pressure, heart, liver disease, kidney disease. If you have really bad migraine headaches, it could worsen those if you take birth control. A family history of blood clots. So it does increase your risk of blood clots, not too much because you're just taking them for a short period of time. If you're 35 and you smoke, vape, hookah, obviously you're at a higher risk of blood clots. So just stop smoking. 5 days. Or if you've had a baby recently, it's not good to take OCPs because of bleeding purposes. History of cancer, history of very high cholesterol, etc., etc. All right, so there's really two options, and I usually recommend the second one. The first one is a combined contraceptive, estrogen, progesterone. It's like the normal 28-pack one that you get. There's many different names for it, many different types, but pretty much a 28-day pack. They're like colored like pink or yellow, and then you have those are 21 days, and then the last week is usually white in color. What you will do is you'll just skip those 7 white pills and just start the next pack. So you're skipping the days. They're called placebo pills, where your menstruation will start, and so it'll in essence you'll skip your period at that point. So if you've been taking these OCPs 28-day packs, you would just continue taking them regularly. I wouldn't, obviously, if you're just starting now, you wouldn't start this because it's too late at that point. The one that you can start still is the progesterone only. This one right here. It's called NET, Northern. It's hard to say, but this pill, it's a 5 mg tablet, okay, and you can take it if you start it 3 days before you go. It's 3 times a day pill, and you take it just make sure you take it every day at the same time. Don't one day take it 8 a.m. and then the next day you take it at 11 a.m. That messes up the cycle, right? So try to take them all at the same time. Same times in the day. So 3 times a day, start 3 days before you go, and then you can take it up until the Hajj finishes. And usually your period will then begin a few days after you stop taking it. So again, you need to take this 3 times a day, 3 days before you expect your period to begin. This will delay your period until about 3 days after you have taken the last tablet. Okay, so if your period is set to begin on Thursday, all right, so you start 3 days before that, and it will more than likely delay the period up until the last day you take the pill, and then maybe for a few days after that, you'll develop the period then at that point. But again, really talk to your OBGYN about specifics, individuals. These are safer than regular birth control pills because, again, you're taking them for a short period of time. They don't necessarily increase the risk of blood clots, and this is the one that we recommend for most people. What can be done about breakthrough bleeding? Again, talk to your OBGYNs mainly, but there's some certain things that you can do. Stay on schedule with your pills, tracking them. Typically, reassurance that breakthrough bleeding is decreasing. So if you're having bleeding, but it's just getting lighter and lighter, that's just breakthrough. It's not like you're starting a period. And then if you smoke, obviously you're going to have increased risk of breakthrough bleeding. Common conditions, illnesses. So these are things that you have to look out for during Hajj. Upper respiratory infections, right? AKA the Hajj cough. This is very common amongst Hajjis. People that come to Mecca, Medina, all have this really. It's a different kind of cough, right? It's a lot of times it's dry. It's more significant. You have body aches with it as well, and I would say it's probably more severe than the upper respiratory infections that you get here in America. And then we're going to give you medicines at the end, so you don't have to like, what are you going to do about it? You'll see. GI diseases, so stomach flu, gastroenteritis, very common, right? Overcrowding, potentially, gastroenteritis from bad food. So just potential is there for these food poisoning, diarrhea, skin issues, so being sunburn, infections, etc. So if you have very sensitive skin, just be aware of that. Allergies, so dust. If you have allergies to dust, please bring something like Claritin, some antihistamines to take with you because even if you don't have them necessarily where you are in the West, you potentially go there and there could be something that's blooming, or you could be potentially allergic to something that you're not aware of, and then all of a sudden now you're sneezing, you're coughing, and you got watery nose, watery eyes, runny nose. So just bring some antihistamines to help with that. And then obviously we talked about heat exhaustion and dehydration. So pilgrims with chronic disease, they're advised to carry documentation of all their health conditions, right? It's important, right? Because God forbid something happens. If you have documentation on you, on your person, then we'll be able to know what to do. If God forbid you pass out, you're diabetic, somebody's going to know, hey, maybe, they need sugar, maybe they need something else, maybe they need insulin. So if you have documentation of your chronic diseases on you, then we'll be able to take care of the situation. These are just different diseases that you should be cognizant of if you have to bring documentation that you have them: heart disease, diabetes type 1 and 2, asthma, COPD, epilepsy. Edema in the legs is important. A lot of walking. People are going to get a lot of swelling in the legs. So if you have a history of getting chronic edema in the legs, try to bring some like compression socks. You can even take some diuretics if you need to, potentially. Don't be worried, oh, I'm taking a diuretic, I'm going to have to go to the bathroom. Again, you will be able to find facilities now, alhamdulillah, to go to the bathroom. So you can take the diuretics. And then dialysis. If you're on dialysis, please contact proper authorities, inshallah, Al-Bayt, to make sure that you're able to get your dialysis, inshallah. Bladder, UTI, substance abuse, anxiety, panic attacks. So this is very common, right? People already are anxious when they're leaving their homes and they're going on a journey of a lifetime. If you have a history of anxiety, panic attacks, claustrophobia, big crowds, things like that, make sure that you talk to your primary care doctor, if you have a psychiatrist, to get the right medications. Even if you have panic attacks, there's certain medications that you can take. There's certain breathing exercises that you can do to help mitigate these adverse effects. So if you have high blood pressure, make sure you bring your blood pressure medications. These are all basic things. Take your medications regularly, and then make sure you adjust if you're not eating normally. If you have angina, if you have heart disease, make sure you bring nitroglycerin with you, potentially, and then make sure that you talk to somebody about wheelchair accessibility. So you don't want to be left alone. If you need a wheelchair, talk to a legacy beforehand, inshallah. Try to avoid salt. I mean, it's difficult when you're, not cooking food on your own, but try to limit your salt intake. Eat in moderation. This is a very important thing. We get to Hajj and we're sitting in our camps, and a lot of us have nice tents, and there's food, mashallah, everywhere. There's, when you walk by your tent, you're going to see ice cream station, you're going to see juice station, you're going to see buffets with tons of food and snacks, and just try to eat in moderation. Just recognize that, you're on a journey of a lifetime. You're trying to focus more on your ibadah. Obviously, you want to eat and you want to, keep yourself sustained. But we're not here to indulge. Aspirin, blood thinners, and then if you can bring your portable blood pressure monitor, that would help a lot. Instead of having to look for one, ask somebody for one. If you're diabetic, bring your glucometer, adjust medications if needed. I'm gonna end soon so you can ask questions, inshallah. Recognize symptoms of hyperglycemia, hypoglycemia, asthma. Make sure you bring your medication for your asthma. They can flare up, albuterol, or even your chronic asthma inhalers. If you have a history of epilepsy or seizures, please inform your group leaders about this. It's very important that you let legacy and Obey know if you have these chronic diseases. So, for edema, leg swelling, so you can bring aspirin, blood thinners if you're at risk for blood clots. You can ask your doctor to see if a diuretic will help. It does help with leg swelling. The last thing you want is to not be able to walk anywhere because your legs are so swollen. And then compression socks, right? So it's important if you do have this to just wear like tight socks. That can definitely help. And again, avoid salt intake. Again, if you're on dialysis, please talk to your group leaders, and please arrange for dialysis before you go. You see everywhere, avoid salt, avoid salt. Bladder issues. So if you have a bladder issue where you're constantly going to the bathroom, antihistamines do help. It can help in urinary retention. So again, I would talk to your doctor about this if you do have bladder issues. Then, I mean, smoking, I mean, that's without saying, stop it. Like we talk about anxiety, panic attacks, bring anxiety meds if you need to. If you have insomnia, magnesium, melatonin do help in helping you sleep. So it's something that you could think about bringing. Try to avoid, crowded areas. Breathing techniques do help. Here's a few pro tips and gems. Vaseline for men, very, very important for chafing. To apply to your thighs. It's very, very important. I mean, I can't stress. I mean, it's highlighted. It's not highlighted, but it's all caps. There's 4 exclamation points. Just know that it's important. Unscented soaps, wipes, tissues. Make sure you bring those with you. Like we talked about, condition yourself. Diet, eat light. Avoid any. This is the fast food. There's fast food everywhere. There's El Bake, right next to our tents in Mina too. But try to avoid fast food. Try to avoid like heavy foods. It's not going to help you get you through Hajj. And then obviously sandals. I'm sure you guys have gone through those already. Comfortable sandals. Don't put your sandals on for the first time when you're starting Hajj. Please walk with them a little bit. Antihistamines again. If you have your bladder is small, or you just go to the bathroom a lot, you can take antihistamines to help. Wash your hands regularly. It's going to help prevent infections. Um, Change clothes frequently. It's important to do that. Um, Alcohol sanitizer is fine to use. And then extra pair of glasses. This is something people don't think about, right? But God forbid, you have bad eyesight and something happens to your glasses, you'll be struggling. So, if you can, try to get an extra pair of glasses before you come, inshallah. Masks, this is more during COVID, but you can talk to Sheikh about potentially wearing masks during Hajj. And then, obviously these are just basic things, coughing, sneezing into your arm, not into everybody else. Some pro tips: keep away from foods exposed to insects, contamination, avoid buying food from street vendors, wash your hands thoroughly, verify, canned foods, dates. The food that you're going to eat, you don't really know. I mean, it's difficult to know, if the food's been sitting out for a while. But take a look at it, smell it before you're eating it for potential to see if it's potentially gone bad or not. This happens during Hajj in Arafat a couple of years ago. Everybody got sick. Everybody was like struggling. Fortunately, the food was for some reason contaminated, and some people, started immediately having diarrhea and vomiting throughout Arafat. So just be conscious, be cognizant, look around, make sure you wash your fruits and vegetables well before eating them. Medications to bring. I think we'll share this slide with you. Imodium, Pepto-Bismol, Sudafed for congestion. For those that have allergies, fluticasone, Tylenol, Motrin. Vitamin C is something that I would definitely recommend bringing with you guys, inshallah. Prescription meds, so antibiotics. I would bring a Z-Pack. I would bring Cipro, right? Those are two that for sure I would bring. Talk to your doctor, say, I'm going on this trip, I need a Z-Pack and Cipro. Cipro you can use for upper respiratory, you can use for GI, same thing with Z-Pack. So those are like, if you're gonna get two, I would get those. Steroids, I mean, I'd probably hold off on that. Talk to your doctor about that if you want to bring steroids or not. If you have a weak stomach, you can bring Zofran to help with nausea and vomiting, and then antihistamines like we talked about. Hydrocortisone is important, right? If you have a rash, sometimes you can go there, you get an insect bite, and it gets worse. Just put some hydrocortisone on there. So that's important to bring as well. And then some pain medications with you. Seek medical help. If you have chest pain, okay, shortness of breath, dizziness, excessive sweating, stroke-like symptoms, pain that's kind of spreading from your chest to your left arm, to your jaw, to your neck, make sure you seek immediate medical attention at that point. After Hajj, there's the post-Hajj blues, post-Hajj cough. So make sure, if it continues, please go see your medical doctor. Children are not going to be there this year. Let's go back to Zoom. So let's look at questions. You guys can start asking questions if you want. Inshallah, we have like 20 minutes for Q&A.
Dr. Samad,
Are there
Assalamu
questions in the chat? Wa alaikum assalam, Mustafa. Is that you,
Mustafa.
Mustafa?
Yeah, my name's
Assalamu alaikum,
Mustafa.
Mustafa. How
Hi.
are you, brother?
I'm good, thank you so much, and thank you for the very nice session and all the information you provided.
And
So
Jazakallah khair.
yeah,
May Allah
yeah,
just make dua for me, inshallah.
I
That
will.
yeah,
I'll make
inshallah. I
sure
mean,
I
you
I'll
guys are
make
on a
sure I add
journey of a
your name in
lifetime.
my book.
MashaAllah. I'm so excited. MashaAllah. The whole ummah is
Yeah,
excited that you guys are going, and that inshallah Allah subhanahu wa ta'ala accept your Hajj and bring you back. What's your question,
inshallah,
brother?
inshallah. So I have a question. I was looking through Nosok website, and I saw an app. It's called Sahati. I'm not sure if you are familiar. It's saying that you can add your information like health record and your medications. I'm not sure if this is something for everyone. I tried to log in and
Uh-huh.
I download the app and try to get into it and I create an account, but it doesn't really allow me.
Yeah. I mean, listen, just I mean, Hajj is very like I don't know. I don't think they've gotten to that level yet where they're going to be able to kind of log in and kind of check out your medical history from an app at this point, mostly in a medical emergency. So that's why I think just bringing a paper, form or just an information packet with your chronic medical issues. I think it's important to just have it on you with a copy, just in case something happens to a bag or two. So I mean,
Right.
this stuff is good in theory, but in practice, what I've seen is a lot of times it's not utilized. Um, so if you have chronic issues, try to just put it in a place in a bag that's easily accessible.
Inshallah. And then I have two uh, suggestions. The
Yes,
first one for antihistamines, or I mean for allergy medications.
yes,
Benadryl is a stronger medication, but at the same time, it will cause you sleep. So,
yes.
would you think it's a good idea to use it maybe if Claritin or other antihistaminic won't work?
Yes, of course. Very, very good suggestion. I mean, like a Zyrtec, I like Zyrtec. Everybody kind of reacts differently to different antihistamines. Some people will get drowsy with Zyrtec. Some people get drowsy with Claritin. But yeah, Benadryl will definitely lead to increase in drowsiness compared to the other ones. So you're right. Things like Claritin, Zyrtec are probably a better choice in terms of an antihistamine. Jazakallah khair for that.
So, thank you. And then the last point, I just want to remind everyone: if you are diabetic, get order a travel ice pack, something for backpack for travel to put your insulins in it. If you want, is something like $5-10 on Amazon. And that
Jazakallah khair. Very, 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 very important recommendation and suggestion from Brother Mustafa Taheed. Inshallah. Jazakallah khair. So for travelers to the US, we need meningitis. Yes. Anything to avoid MERS. I mean, not necessarily. I would say try to cover your face. Your face mostly when it's dusty. If you have a scarf. But when you're in ihram, it's difficult. So try to avoid crowded areas as much as you can. Hand washing, good hand hygiene is very important as well. What first aid would be available? So they have medical tents kind of throughout. Mashallah, they've done a really good job now of providing kind of good first aid. It's better than before. Um, so the items that we kind of showed you, I would recommend packing those. And then for more severe or significant issues, then seek medical attention from either Legacy or Al Bayt or any of the thousands and thousands of volunteers that are kind of there along the route of Hajj. You're going to see many, many people there. Will our health insurance cover us during Hajj? It should, depending on where you go. You have to. I think once you get there, talk to your guides. There's certain hospitals that take Hajj medical insurance, and there's certain hospitals that don't. And when you're there, just make sure that you're conscious of that. and talk to the guides. They'll give you feedback on where to go if you have a medical emergency. The period stopping medicines, the ones I recommended, NET, that's you start that 3 days before you go. You start that 3 days before before your period begins. And so that will delay your period up until you stop taking it, and then after that, it's about your period will begin maybe a few days after that. Claritin, yeah, any of the antihistamines can help urinary excessive urination. You're saying will Claritin help in urinary retention? So it'll help cause urinary retention. Can you use a neck fan in a haram? That is a Sheikh Hasib question, but I believe, yeah, it shouldn't be a problem. And the dosage for that is 5 milligrams for the oral contraceptive. 5 milligrams 3 times a day. Yeah, you can get antibiotics from your PCP. Yeah, if you talk to your primary care doctor, most of them will prescribe you antibiotics for Hajj. Most of them are aware of Hajj. They have patients that are going on Hajj, and they'll be able to prescribe you these antibiotics. Inshallah. Can you buy over-the-counter medications? Yeah. So in Saudi, they used to just kind of pharmacies used to be using about antibiotics. Now you have to have a doctor's prescription. So it's better. It's better to take the prescriptions from here. There's Nahdi pharmacy all over Mecca and Medina, so you can get over-the-counter medications there, no problem. But for the antibiotics, you're going to have to get a prescription. So I would recommend you get it from here before you go. Inshallah. Anything else? Sounds good, inshallah. Keep us all in your special du'as. Make du'a for the ummah. We're in a very difficult moment in time, and we're kind of counting on you guys to uplift us. Your du'as are answered, inshallah, and Allah subhanahu wa ta'ala accepts all of your Hajj, inshallah. May Allah subhanahu wa ta'ala bring you back safely. You guys are going on a journey of a lifetime, inshallah. It's unbelievable journey. I'm so excited, I get so excited thinking about you guys going. So I'm sure you guys are very excited. Inshallah, keep us in your du'as. You guys are going with an amazing team. Inshallah, legacy is unbelievable. And mostly Sheikh Hasib, throughout the whole process, you guys are going to feel like you guys are really, they keep you kind of grounded. They keep you in the moment, and all the extra things that are happening around you, they take care of. So you're able to focus on Hajj and focus on Arafat, inshallah. So, Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.